So I'll talk about the anatomical aspects of pleura. What is a pleura? Pleura is a serous membrane that is lined by mesothelium or flattened epithelium. We need to understand three important terms. One is pleural sac, and the second term is pleural cavity. Third term is pleural fluid. Pleural fluid. Firstly, I'll talk about pleural sac. Pleural sac. So now equate pleural sac to a balloon. And we have two pleural sacs, one on the right side, one on the left side. And in between these two pleural sacs, we have the developing lung. We have the developing lung. As the lung develops, as the lung bud develops, it is going to invaginate the pleural sac. It is going to invaginate the pleural sac like this. It is going to invaginate. So once the lung fully grows, it is going to look something like this. So the pleural sac got decompressed because of the developing lung bud. And once the lung grows, it is going to look like this. This is the matured lung. And this is the pleural sac that got decompressed, right? So now we need to understand the part of the pleural sac. The part of the pleural sac that is lying away from the lung is called as parietal pleura. And the part of the pleural sac that is lying close to the lung, is called as visceral pleura. It's called as visceral pleura. So there are a number of differences between parietal pleura and visceral pleura. And I need you to remember two important differences. The first important difference is this visceral pleura is tightly adhered to the lung. Whereas parietal pleura is not tightly adhered to lung, thereby it is separable. It is separable. Whereas visceral pleura, it's not separable. It is not separable. And the other important difference is the source of blood supply. They have different source of blood supply. We need to understand this when we learn about pleural fluid. So the gap that got created between these two pleural membranes, parietal pleura and visceral pleura, is called as pleural cavity. Is called as pleural cavity. In this image, you can see this is parietal pleura, this is visceral pleura, and the space in between parietal pleura and visceral pleura is called as pleural cavity. Pleural cavity. Parietal pleura, depending on its location, they have different names. They have four different names: cervical, costal, diaphragmatic, and mediastinal. In this image, you can see this part of the parietal pleura that is closely related to the cervical region is cervical pleura. The part of the parietal pleura that is closely related to the rib cage is called as costal parietal pleura. And this part of the parietal pleura that is related to the diaphragm is called as diaphragmatic pleura. And the part of the parietal pleura that is related to the mediastinum is called as mediastinal parietal pleura. So far we have understood what is pleural sac, what is pleural cavity. And the next important term for us to understand is what is pleural fluid and where is this pleural fluid present. As you can see in this image, pleural fluid is present between parietal pleura and visceral pleura. Basically, this pleural fluid is present in the pleural cavity. But where is the pleural fluid produced? In this image, we can see this is visceral pleura and this is parietal pleura, and this is pleural cavity. This is pleural cavity, and this is our pleural fluid. Pleural fluid. And I've taken this part and I have drawn it bigger here. So this part is called visceral pleura, and this part is your parietal pleura, and here would be your pleural fluid. And this cavity between these two layers is called as pleural cavity. So now let me explain how this pleural fluid is produced. I've told you earlier, visceral pleura and parietal pleura have different blood supply, right? Pleural fluid, what is the source of this pleural fluid? What is the source of this pleural fluid? Mostly the source of this pleural fluid is from the parietal pleura blood supply. And it is not very negligible amount comes from the visceral pleura blood supply. Very negligible amount comes from the visceral pleura blood supply. So now we need to understand what is the blood supply of the parietal pleura, what is the blood supply of the visceral pleura. So here in this image, you can see this is parietal pleura, this is visceral pleura, right? Parietal pleura, they have systemic blood supply, meaning based on the location, they get the blood supply. For example, this part of the parietal pleura gets their blood supply from internal thoracic artery. This part of the parietal pleura gets their blood supply from intercostal artery. And this part of the parietal pleura gets their blood supply from musculophrenic artery. So parietal pleura have systemic blood supply. So venous drainage is the same for them. So I told you intercostal, internal thoracic, musculophrenic artery. So the venous drainage is also the same, but eventually they will drain into asagus vein. Eventually they drain into asagus vein. What about the arterial and venous supply of the visceral pleura? Here you can see visceral pleura. So I mentioned earlier visceral pleura is very closely related to the lung, right? So the blood supply to the visceral pleura is also from the lung side, meaning from the bronchial vessels. The bronchial vessels supply the visceral pleura, So now we need to understand how the blood supply from the parietal pleural side contributes to the pleural fluid. So here I have drawn, this is the arterial side, this is the venous side, and this is the capillary side. Fluid leak, fluid leak happens at the level of capillaries. Fluid leak usually happens at the level of capillaries, right? So this is the parietal pleural side, and we know the arterial supply to this parietal pleura, and we know the venous drainage of this parietal pleura, right? So we know parietal pleura have systemic blood supply, right? Systemic blood supply. Usually blood pressure in the systemic circulation is high. Blood pressure in the systemic circulation is high, right? So pressure here would be high. Pressure here in the arterial side would be high since they have systemic blood supply. What about the pressure in the venous side? What about the pressure in the venous side? So usually pressure in the venous system has to be low than the arterial system. Then only blood can flow from the arterial side to the venous side, right? Here we have asagus venous system, but here the blood pressure is slightly high, but not as high as the pressure in the arterial system. So I told you here the pressure is slightly high, here the pressure is very much high. So the fluid is going to run from the arterial side to the venous side, right? So what about the pressure at the level of capillaries? So the pressure at the level of capillaries will also be high. Since the pressure at the level of capillaries is high, fluid is going to leak at the level of capillaries. And then they are going to enter pleural cavity. I'll explain. I'll give you an analogy for this. So here you have faucet, right? Here you have faucet, and here you have the drain. Imagine the size of this drain is very small. Size of this drain is very small, and this side is your arterial side. This side, the drainage side, is your venous side. And fluid and the water is going to run from the faucet side to the drain, right? If the size of the drain is very small and the pressure from the faucet is very high, what will happen? Water will not drain. It will get accumulated like this. So pressure here would increase, right? Pressure here would increase. So this is what is happening there also, right? So we have high pressure arterial system and we have little bit high pressure in the venous system, and between we add capillary. So fluid is going to come like this. Since the pressure in the venous system is little bit higher, it will take some time. It will take some time and for the fluid to get drained into the venous system. So meanwhile, the fluid is going to stay in the capillaries and pressure is going to increase and the fluid is going to leak at the level of capillaries. So when the fluid leaks at the level of capillaries, they are going to enter into the pleural cavity. They are going to enter into the pleural cavity. So this is what is happening at the level of parietal pleura. So what happens at the level of visceral pleura? So I told you what is the blood supply of the visceral pleura, right? So the arterial supply is the bronchial artery and the venous drainage happens via pulmonary veins. Here, the pressure in the bronchial artery is high, whereas the pressure in the pulmonary venous side is quite low. So fluid leak at the level of capillaries is very minimal. So this is our visceral pleural side, right? But this fluid leak is very, very negligible. I'll explain you why. So I'll take the same analogy. So this is our bronchial artery. This is our pulmonary vein. So I told you this drainage is very big. This drainage part is very big. Now the water from the faucet is entering at a high pressure, but now there is no water logging happening. Now there is no water logging happening since drainage can happen smoothly. Since drainage can happen smoothly. So this is what is happening here also. Even though water fluid is coming at a very high pressure, since the pressure at the venous side is low, drainage can happen very easily. The chance for the stagnation at the level of capillary is very low, thereby fluid leak is also very minimal. Fluid leak is also very minimal. Therefore, they do not contribute to the pleural fluid. So far I have discussed how pleural fluid is produced. How pleural fluid is produced. Now we are going to see how pleural fluid exits from our body. How pleural fluid exits from our body. This is our parietal pleura. This is our visceral pleura. In the parietal pleural side, we have something called as stoma. We have something called as stoma. Stoma is nothing but opening. So as you can see here, this is our parietal pleural cells. This is our parietal pleural cells. And in between these two pleural cells, we have a gap here, right? We have a gap here. Basically, an opening. An opening is present. An opening is present. Whereas if you see in the visceral pleural side, we do not have any opening. We do not have any opening. So the fluid which got produced, they're going to exit through the stoma present in the parietal pleural side, and they are going to get dumped in the lymphatic system. They're going to get dumped in the lymphatic system. Lymphatic system. So that is how pleural fluid which gets produced exits the pleural cavity, exits the pleural cavity. An important concept we need to understand here is while the pleural fluid exits the pleural cavity, the amount of pleural fluid is getting reduced. Because of the suction effect produced by the lymphatics, there is a slight negative pressure that gets created. Slight negative pressure that gets created in the pleural cavity. Negative pressure gets created in the pleural cavity. So this becomes important when I explain about the physiological aspects of pleura. Physiological aspects of pleura. So the last thing we need to understand is about the muscles. Muscles that help with respiration. So we have diaphragm that separates thoracic cavity from abdomen, right? From abdomen. So when diaphragm contracts, there will be increase in thoracic cavity volume. It helps with inspiration. It helps with inspiration. When diaphragm relaxes, thoracic cavity volume decreases. Thereby, it helps with expiration. It helps with expiration. The next important muscle group is intercostal muscles. So what is the So what do I mean by intercostal muscle? We have one rib, we have another rib. The space in between these two ribs is called as intercostal space, and this space is occupied by intercostal muscles. We have three group of intercostal muscles. First one is the outermost one is external intercostal, and second one is internal intercostal. Third one is innermost intercostal. These two muscles are very important for respiration. So in this image, you can see this is sternum, this is sternum, medial side, this is lateral side, and this is our external intercostal. And we are going to zoom and see here, medial side, lateral side. So what is the direction of this external intercostal muscle? So the origin point is here, the insertion point is here. They are running down like this, they are running down like this. So it is downwards, it is downwards, forwards, they're running forwards and towards the medial side, towards the medial side. So this is the direction of the external intercostal. So what about the internal intercostal? This is the origin point, this is the insertion point. They're running down like this. They're running down like this. They're running downwards, backwards, and laterally. And laterally. So this is the direction of internal intercostal muscle. So how do they help with respiration? So for any muscle to contract, they'll contract from insertion to origin. Insertion to origin. For example, this is the insertion point of biceps, right? So when they contract, they're going to contract from insertion to origin towards this direction. So when biceps contracts, it is going to cause flexion. Similarly, we know the insertion and origin points, insertion and origin points of external intercostal and internal intercostal. So this is the origin, insertion, origin, insertion. So when they contract, they're going to contract from insertion to origin, right? So when they contract, they're going to lift up the thoracic cage like this. They are going to lift up the thoracic cage like this. So when internal intercostal contract, they're going to contract in this direction. They're going to contract in this direction, thereby bringing the thoracic cavity back to the normal position. Back to the normal position. So that is how diaphragm and intercostal muscles help with respiration. And that is all you need to know. That is all you need to know about the anatomical aspects. Thanks.